Well, actually, we are just delivering the lecture on Monsoon Fever Syndromes, a very new topic, and my students of MCA's class of Israel University will learn some of the important aspects of what is monsoon and what is monsoon fever and what are various syndromic approaches to this. So today we are recording this on the 8th September 2025 in the MCPS class of Israel University. So let us move further. This is monsoon word is an Arabic word in origin, and the Monsoon is the actual word which was used by the Arab traders many centuries ago, because this is also called Arabian Sea, which is branched in part of the Indian Ocean, and the Bay of the Bengal is also part of this Indian Ocean. So that is a part of the important aspects where from this monsoon word is so popular, and in Urdu or in Sindhi we call it Chauma Sedo Mosam, but Mosam word is very common. So what are various diseases actually? So the fever is one of the important febrile illnesses, is the common feature of most of the diseases occurring in the monsoon season, whether it is viral, whether it is parasites, whether it is fungal, whether it is bacterial. And you can see that the monsoon fever is not a single diagnosis. It is a syndrome, or it has many symptoms, but the fever is one of the important clinical symptom which makes this very much close to the monsoon season, though we have many other diseases around the year, but their intensity as well as frequency and the complications, they are on increase in monsoon disease. But a term for the variety of illnesses including dengue, malaria, typhoid, leptospirosis and respiratory infection. You can see that how many are the combinations. Normally we divide the diseases: digestive diseases, respiratory diseases, muscular diseases, and other kind of the disease. But here you have amalgam or a combination of that. That become more common during the rainy season. Basically, monsoon is the summer season in which clouds, rains, and flood in the water, rivers, as well as there are cyclones and ocean. They have another activity of the water-related or hydrological in nature. Increased mosquito activity and poor sanitation. Symptoms can vary widely depending on the specific illness, but common ones include high fever, body ache. These are the sequence. The patient will complain fever, patient will complain body ache, and headache, diarrhea, nausea. So prevention involves drinking boiled or treated water. That is very important. Then we have avoiding street food, taking precautions against insect bites, and practicing good hygiene. So these are the common monsoon illnesses in brief in the start. But we will see in detail also. You can see that the other symptoms are also: fever is there, cough is there, cold is there, headache is there, and apart from this we can have malaria, diarrhea, hepatitis A, and this can be the entire spectrum of the monsoon fevers. Then coming to the important dengue, which is a viral disease, and it is mosquito borne, and we call it arboviruses also. And this is a very dangerous disease because it causes platelets reduced and ultimately bleeding tendency. That's why this is also called five types of hemorrhagic fever. You can have fever, you can have reddish spots on the body as well as epistaxis and other bleeding tendencies. Then is the malaria. Malaria is a very common name. Everybody knows that it is a mosquito, but the dengue is by Aedes aegypti, another type of the mosquito, and malaria is from the Anopheles. So the symptoms are different. Here the bleeding tendencies are less, but both the diseases, they cause a lot of sickness, severity, as well as there are many complications also. Then comes the bacterial typhoid is on the top, and contaminated food and water and bad sanitation, they are the main causes, but the water which is moving from one place to other place can bring many pollution, pollutants and hazardous as well as the microorganisms. Respiratory infection, viral infection can be pneumonia, monsoon type pneumonia can also be there, similar to flu and common cold. Next, we are just seeing the condition of the monsoon. This is just a few days ago. The picture from Punjab, you can see that the people are on the top of the house and stay inside, and water is rushing and water is flowing. Even the animals, children, everything is displaced. So in that condition, how you can maintain the health? But you have to survive, you have to face this kind of, and even the food related problems are there. There can be malnutrition, there can be dehydration, there can be shortage of the medicines. Even the hospitals, they are underwater, so you can't function as a doctor. This is a published clinical profile of patients presenting with complication of acute febrile during monsoon. You can see this is a published article in the journal, and this is a study from the Bombay, and the abstract shows, but this graph shows, you can see that the dengue is on the top. This is the dengue bar, and followed by another which is leptospirosis, then is the malaria, and then is the hepatitis. So you can see that as the monsoon starts from the January, March, it shoots up and up to the August and September. This is the September, 8th September. So you can see the graph is on the top of the three illnesses in which dengue, malaria, leptospirosis, that is a viral disease and related to the dirty water and even with the animals and other. Scrub is also one of the important fever which causes a lot of complications. This is another picture. You can see that 35% receive invasive mechanical ventilation. So the tertiary care hospitals, they also get more patients, and thrombocytopenia and rash is the most common admission problem, and approximately 20 to 30% of all ICU admissions across the country. And dengue, malaria, scrub typhus, viral encephalitis are the major causes of tropical fever infection, and you can see that on the top is the dengue, followed by the scrub, and then is we have encephalitis, malaria, as well as sepsis, pneumonia, and viral hepatitis, typhoid, dengue and malaria commonly can also occur in the patients, and H1N1 also, which is flu, bird flu is also a problem with this This is actually meningitis, encephalitis, or Japanese meningitis. We call it Japanese encephalitis also. So this I have taken from one of the hospital in Hyderabad, India. And this will give you a picture. This is the published data. So Pakistani doctors, GPs can learn that what type of the monsoon fevers they can face. Take-home message is they are giving that a symptomatic approach should be important, and history is important, as well as detail of the diet, recreational activities, travel, and incubation period is a little bit longer, 5 days or more, so you should have and a syndromic approach to narrow down the list of possibilities, because every disease itself has its own diagnosis, test, treatment. Therefore, you have to think which can be out of 10, 12 diseases. This is common dengue, streptitis, leptospirosis, encephalitis, which is inflammation of the brain, malaria are common causes of monsoon fever. Scrub is less discussed here, and this is also a kind of typhus fever, or it is organism normally a spirochetes and some of the other forms also. And these are the patients which normally end up from the home to the latest GPs or primary health care, secondary, and then ultimately. Some of the treatments which can be they are there, doxycycline, azithromycin would be appropriate for empirical therapy, and acyclovir, this is antiviral, may be considered in addition for patients presenting with encephalopathy while waiting for laboratory report. So this is basically not a local level, but in which the aspirin and other bleeding disorder drugs should be avoided. Next. This is another frequency. You can see that multi-organ are also affected by these diseases, and 5 organ symptoms involve 6 organs, 2 organs, 1 organ. So you should think that it is organ failure or organ derangement, or their function is not there, and you can see that this is from experience of the Indian hospital a few months ago. Monsoon maladies, common viral fevers, and their prevention. So you have to reduce the temperature, you have to improve the sanitation, and you have to treat with a symptomatic antibiotic, but mostly you should avoid the aspirin and other things. And if there are respiratory symptoms, then you can think about the more investigations. And diarrhea can be controlled by the use of ORS as well as other rehydration therapy. This is a condition of the fever. And waterborne diseases, cholera, gastroenteritis, spread through contaminated water and food causing diarrhea. So the chlorination and the safety of the water reservoirs, water supply is important. Drink only boiled or treated water, and if you don't have time, please filter it through some of the clean cloths, and we call it in Bangladesh and Malay as a sari filter. So a simple clean cloth, make it 4 or 5 folds up to the edge, and pass water into the drinking utensil, and then you can drink. This will make your water more safe, and most of the bacteria they will be entangled to that because of the charges of negative, positive, and other things. Personal hygiene, wash hands is important with soap, clean water, particularly before eating and after using the toilet. So clean water is not needed for only the drinking purpose, but for your personal hygiene it should be mosquito control, eliminate pregnant water, eliminate stagnant water, cover your body with protective gloves, and use insect repellents to prevent mosquito. So the mosquito nets or the bed nets are important weapon for you, and you must use it. So monsoon fevers can be misleading also. So to diagnose these, because these are the symptoms which are also present in other diseases, even in injuries. So you have to be very selective and very expert. Chikungunya, which causes the joint pains, leptospirosis, which causes jaundice, and this can mimic to the A type and other types of jaundice. So seek medical help. Fever or other symptoms that persist for more than a couple of days, and consult a doctor for diagnosis and appropriate treatment. Monsoon fever syndrome, decoding the differential in ICU. This is just July 25. So good evening, friends. Is your monsoon fever more than cold? Drink only treated water. Avoid water from unknown sources. Say no to street food and beverages. Beverages, they also cause the throat infection and cause the monsoon fever, especially those served cold, like typhoid needs attention. Rainy water for monsoon disease root symptoms. Common monsoon disease during any season. So these are the few published data which we are sharing with you. Thank you very much. I think you have been listening to my lectures to our YouTube channel, Dr. Hussain Bolachi. Though it is an academic activity, but we are sharing with the other people also, and students of other institutions, degree programs, MPH, FCPS, PhD, and even in my video they are being watched in India and other countries where Urdu, Hindi or English is the main teaching language. So please like it, subscribe it. With this, I think I am ending this monsoon fever syndrome, which has a leading symptom of fever, body ache, and in certain cases it was also mentioned that the dehydration is there, headache is there, and diarrheal disease is also part of this. So please, all the GPs in Sindh or in Pakistan, they should learn more about the monsoon fever syndrome and be expert to deal at the primary or at a village level, talqa level. Please like, share it, and also send your comments whether you have good knowledge about the monsoon. And monsoon starts from April to September. So this is important long period in which we have to be healthy as a student, as a farmer, as a teacher, as a doctor, and our environment and economy should also have a healthy look. Thank you very much.